Today I'll be speaking on perfecting the scleral tunnel. The magic and the beauty of size lies in the perfectly constructed scleral tunnel, which is self-sealing and watertight in nature, which facilitates the smooth delivery of any grade of the nucleus, giving least amount of SIA and at the same time correcting the pre-existing astigmatism. So to have a perfect visual outcome, proper planning is required in individual case. So well planned is half done. The concept of scleral incision was introduced in way back in 1983 by Richard Katz. Before going into the main scleral tunnel incision, few important preparation points are proper anesthesia, stabilization of the globe, minimal conjunctival periotomy, and minimal cautery. Variables of the scleral incision are location. Location of the incision could be superior temporal, or temporal. Superior site is preferred for the ease of execution and exposure. Width of the incision is nothing but the distance between the internal and the external incision. The depth of the incision should be half thickness of the sclera. Size and the shape of the incision depends on the grade of the nucleus. The first figure shows the curvilinear or smiling incision, which gives the maximum wound sagging and hence the increased astigmatism, so it is not advocated. The second figure shows the straight line incision, which gives a little sagging and minimal astigmatism, so it is one of the preferred. The astigmatic effect of a smaller incision, which is nearer to the optical axis, is similar to the larger incision, which is away from the optical axis. But doing the steps at this posterior side becomes difficult, hence the concept of frown incision came, where the central part of the incision, which is near to the optical axis, and the edges of the incision are away, so giving a minimal astigmatism. In frown incision, chevron incision, and one of the other popular technique is Blumenthal. So what are the components of the scleral tunnel? One is the external grooving or external incision, scleral dissection forming a scleral tunnel, and entry into the anterior chamber giving an internal incision is normally larger than your external incision. So this is the diagrammatic presentation of the triplanar incision. External scleral grooving is done. Scleral dissection done in half thickness. Here important is the direction of your crescent blade should be parallel to the sclera. Once the dissection is proceeded at the clear cornea, the direction of your crescent blade should be parallel to the cornea. And at the time of anterior chamber entry, the direction of your blade should be parallel to the iris. Hence, the corneal wall created by this gives the self-sealing property to your incision. In this video, we'll be seeing the external frown incision. Mark the incision is done 2 mm posterior to the limbus. By sweeping movements, once you get the correct plane of the incision, see what is the depth of the incision. This is judged by the visibility of your crescent blade knife under the sclera. Once the dissection is completed on one side, by sweeping movements, the dissection is done at the other end and the scleral pocket is confirmed. Here two important points are: the clear corneal incision should be at least 1 mm into the cornea, and the throughout scleral tunnel, the single depth has to be maintained. And while doing anterior chamber, go at the corneal end, see the dimpling and enter parallel to the iris, and cut the corneal lamella when you're moving forward. So while doing the construction, if you're superficial, there may be a scleral buttonholing. And if you are deep into the sclera, you may have a premature entry and iris prolapse. And at the end, it is very important to check the wound integrity. In case of a doubt, place a suture or a two. Patient's vision is more important than the surgeon ego. Though the scleral tunnel considered a difficult step can be mastered by the patient's positive attitude and practice by way of a simulation training, wet lab training. If nothing available, just go vegan way. Your onions, banana, you can make a number of the scleral tunnel. Thank you for your patience hearing.